Now, a new study from Yale says the CDC's 5-day COVID quarantine is too short. Earlier this year, the CDC altered isolation protocols for people who tested positive for COVID. But a study from researchers at Yale University suggests that those protocols are just not stringent enough to stop transmission. So joining us now to talk more about it is Rebecca Ernest, a doctoral student with the Yale School of Public Health. Thank you for being with us this afternoon.
Thank you for having me.
So talk to us a little bit about this study. What did you guys find?
Sure. So our question was relatively simple. We wanted to know if we followed the newly revised CDC guidance of a 5-day isolation period, what percentage of people would actually still be testing positive at the end of those 5 days, especially because the new guidance doesn't say that people need to have a negative exit test. What we did is the university had COVID positive students isolate up to day 5 in accordance with the official guidance. And then instead of automatically releasing them, they had them begin self-testing with rapid antigen tests every day until they tested negative. And what we found was that about a quarter to half of those students were still testing positive via rapid antigen tests on day 5, with that percentage approximately halving each additional day. So relatively high percentages of positivity at the end of 5 days.
Interesting. So in light of that data, what do you think about the guidelines? Should they be changed?
I think our study should certainly be taken into consideration. There's also some other emerging studies out there that are finding similar results. Our data essentially suggests that the current isolation period is about 1 to 2 days too short for the general population. And practically speaking, what that would mean is that if you don't have access to rapid antigen tests, easy tests you can take at home, then a 7-day isolation might be more appropriate. However, if you do have access to those tests, you can begin to start testing out on day 5. And if you're negative, great, just keep masking until day 10.
Yeah, certainly some of this is about personal responsibility as well. And so what would you recommend people do if they get a positive COVID test now?
So, based on our study, what we would recommend is like I said, if you have access to these rapid antigen tests, start taking them on day 5. And if they're negative, then that means you can safely exit isolation, but keep wearing that mask until day 10. If you don't, then a 7-day isolation period would be more advisable, especially if you're living or working where it's hard to distance from other people, or if you're around vulnerable people. But like you said, there is this sort of personal responsibility, this behavioral component. We know it's not just about how much virus is in your system, it's also about your behavior. And so that's why it's really important to maintain distance and keep masking until day 10.
All right, good advice and good information. Rebecca Ernest, thank you so much for being with us this afternoon.
Thanks for having me.